anyone to call OSHA and file a complaint about a dental office, about a factory, about a hospital, any kind of workplace. The way OSHA handles those complaints is to treat them as informal complaints. OSHA will write a letter to the employer saying something like this: Dear Dr. Jones, we have received a complaint that your office is in violation of certain health and safety standards of the Occupational Safety and Health Administration. The complaints are 1, 2, 3, 4, and they will list those for you in the letter. Please write to us within 30 days and let us know in detail how your office is in compliance. In other words, tell them what you have done to ensure that your employees are safe and respond specifically to the allegations that have been made against you. Once the letter is sent, it's closed in almost all cases. In 1 of 10 of the informal complaints, OSHA will follow up with an inspection. And the American Dental Association headquarters building had the pleasure of going through an OSHA inspection based on a complaint from an ex-employee that was followed up with a very detailed letter, and ADA became the 1 in 10 to be inspected. What are the chances of your office being inspected on a random target basis? Very slim. OSHA does not conduct random target inspections unless an office has 11 or more employees. That exempts most of dentistry from random target inspections. That brings us back to employee complaints. Now, for those of you who are employees in a dental office, I urge you not to run out and call OSHA when you have some problem with your employer. You should try to work it out. Speak with your employer, show them articles or manuals, things that you think need to be done in your office to bring it into compliance. Try to work things out. It doesn't make for a great working relationship to have it be adversarial, where an employee is calling and filing a complaint to OSHA. Since we're focusing on employees and employee complaints, I think it's important for you to be able to know who is an employee. Who does OSHA consider to be an employee? Part-timers, yes. Full-timers, yes. Temporary employees, yes. Associates, yes, unless they are considered independent contractors. The owner of the practice, yes, if the owner of the practice is an employee of a professional corporation. The owner of an unincorporated practice, no. The owner of an unincorporated practice is not considered an employee for purposes of OSHA. Does that mean that OSHA can't come into the office of an unincorporated employer? No. If there are employees, OSHA can come in. But we're talking about who is an employee, who does OSHA have jurisdiction to regulate? Well, how can you tell whether someone is an employee or not? If it's a borderline question, how do you know? The test that's used is very similar to the test that the IRS uses. Does the employer have the right to control the work of this individual? Does the employer have the right to control the conduct of the individual? If yes, then OSHA will consider that person to be an employee. Let's talk about the rights of the dentist in an inspection. First of all, and this is a very important constitutional right, the owner of the practice has the right to demand a warrant. An OSHA inspector is not allowed to waltz in the door and walk through the office if the dentist says, no, I will not allow you to do that. The inspector would have to go back and get a warrant, just like a police officer would, and come back with the warrant, show you the warrant to be allowed entry. Should you ask for a warrant? Well, there are pros and cons. One primary advantage is that it gives you time. It gives you space to lower your stress level, to make sure everything is ready when the inspector comes back. Maybe discuss it with your employees, call your lawyer, call the American Dental Association, and basically just be prepared. Have a few extra minutes or a few extra hours, maybe a few extra days before they come back. Is there any downside to it? Maybe. The inspector might not be real happy with you if you send him or her away to go get a warrant. Should you ask for a warrant? I can't answer that for you. I think it's something that you should think about and something that you should have ready in your mind before an inspector might walk through your door. I will tell you that most dentists who have been inspected have not asked for warrants. A few of them have. You have a right to a copy of the complaint. When the inspector comes in, he or she will have a piece of paper that has the complaint on it. It will not have the name of the person who filed the complaint, but it will have the very specific allegations that are made against you. For example, exposing employees to bloodborne pathogens, not having MSDS sheets, not having hepatitis B vaccinations in place. They will be that specific if the complaint was that specific that was made to them. Read the complaint before the inspection takes place. Make sure you know every item that is on there so that you understand what the inspector is going to be looking for. The owner of the practice also has a right to accompany the inspector throughout the inspection, and I feel very strongly that every dentist, owner of a practice, should exercise that right. Don't give it away and don't delegate it to someone else. You need to be in charge. It's your office, your records, your employees. Stay with the inspector. If the inspector comes at a time when you are not free, you're in the middle of seeing patients, or you happen not to be there that day, please make sure your office knows that there can be no inspection unless you are present and unless you are with the inspector at all times. One of the things the American Dental Association has asked OSHA to consider is the fact that a dental office is very different from a factory or an industrial setting because you have patients in your office. And there is a privacy issue here that does not exist in other workplaces. And the regional administrators around the country for OSHA have agreed that they will try to accommodate dentists who say, I have a patient in my chair, could you wait in my waiting area for an hour? Or could you come back this afternoon? Could you come back tomorrow? I can't guarantee you how every inspector will react to that kind of dialogue with you, but at least try it if it is a problem. If they show up on a day when you don't have patients, go ahead and let the inspection take place and don't try to stop it like that. But if legitimately you have a large patient load, someone is actually sitting in the chair, you should exercise your rights and exercise your concerns for your patients and their privacy. Do object throughout the inspection. Now, later on in this program, you will see a mock OSHA inspection. And one of the things I'd like to ask you to notice in particular is that the dentist owner of the practice does object twice during the inspection to items that the inspector wants to cover and to items that the inspector thinks are required by one of the OSHA standards. The dentist is in charge, he's in control, he's very calm, he's very patient and cooperative, but he makes sure that the inspector knows where he stands. Just because an inspector says something is a violation doesn't make it so. You're the experts on dentistry. They are the experts on workplace safety, but they do not know dentistry like you do. And you know best what's good for your office and what's safe in your office. Are there any limitations on your rights? Yes, there are some limitations. OSHA by law is not allowed to give you advance notice of an inspection. So unfortunately, as much as you might like, they will not call you and make an appointment in your appointment book. They will just show up. Why is that? Well, Congress wanted the law to be like that so that employers, principally in factories and other industrial settings, could not spend a few days or a few weeks getting ready for an inspection, cleaning up, getting ladders out of aisles, painting things, and that sort of thing. The complainant has the right to anonymity. That means the owner of the practice can't and won't know who filed a complaint. And I urge the owners of practices not to try to find out, not to try to figure it out, even if you think you might know. It is a very serious violation of the law to try to retaliate against any employee who exercises his or her right to complain to OSHA. The inspector has the right to interview a representative number of employees. Now, it's hard for a dental office to figure out what's a representative number of employees when typically there's one dentist, one hygienist, one assistant, and one front office person. So what does that mean? Probably it means the inspector is going to want to talk to one chairside person. OSHA will want that interview to be conducted in private, just with the employee. And this is one area where if the employee chooses to, the employee can be legally alone with the inspector, and the owner of the practice does not have a right to be present. But don't go away, don't go home, stay there until the interview is over, and then continue with the inspection. The employee has a very important right to say, no, I do not wish to speak with you, and there's nothing OSHA can do about it. It will not result in increased violations or citations, nothing like that. The employee also has a right to be present. The employer also has a right to be present if the employee wants the employer to be there. I'll give you an example of that. When the American Dental Association was inspected, OSHA wanted to interview one of our building engineers. And the building engineer said, well, I've kind of heard that these inspections are like IRS audits, and I think I want my lawyer here. So I was allowed to be present during the entire inspection because that's what the employee wanted. For those of you who are employees, you can say no, or you can say, gee, I'd really like my boss to be here. I don't have anything to hide. Will you receive citations if OSHA comes to your office? Maybe and maybe not. According to OSHA figures, about 28% of all dental office inspections result in no citations or fines. That's not bad. That's fairly average throughout all workplaces in the United States. And we know of a few dental offices where there have been no citations. And the ones who don't have citations, I think, like to stay quiet and not talk about it very much. But there have been a few. At the end of an inspection, the OSHA inspector will have a closing conference with the employer. And in that closing conference, the inspector will say, these are the things that I found during the walkthrough that I think may result in citations and possibly penalties. The inspector won't actually hand you the citations. It's not like a traffic ticket where right on the spot the police officer writes it out and hands it to you. Citations, if there are any, will come by mail several weeks, maybe several months after an inspection. They come by certified mail. Each violation is listed on a separate piece of paper, and it includes with it what the violation is, what standard is involved, how much is the penalty, if any, and sometimes there are citations that have no penalties, and how long you have to correct the violation. It might be 3 days, it might be 2 weeks, or longer. The employer has an obligation to post the citations in the office in a place where employees readily see it. I would encourage you to post anything you get from OSHA like this